Good evening, everyone. I'd like to call to order the Wednesday, May 27th Community Mental Health Full Board meeting. Please rise for the pledge. Next, we will have Nick with the reading of the mission statement.
There we go. Okay, our mission statement. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which provide recovery, community participation, self-sufficiency, and independence.
Thank you, Nick. Next is adoption of the agenda. Take a motion to adopt.
So moved. Support.
Motion from Megan, support from Lori. Comments, questions, changes to the agenda? Hearing and seeing none. All in favor say aye.
Aye.
Aye. All opposed? Agenda is adopted. Next is item 5 minutes. 5A, request to approve the CMH full board meeting. Oh, I missed hearing on the public. I'm cruising. Anybody from the public? Come on, Jeff. I do it.
September 12th, Health and Wellness Fair. Please come. Okay, 10 to 2. All right.
Thank you, Jeff. I'm sorry.
Aye, Jeff.
You're welcome. Anybody else from the public wishing to speak at a slower speed than Jeff? All right, seeing none, we will close the first hearing of the public. There's one more before the end of the meeting. Now we'll move on to item 5, which is minutes. I'll take a motion to approve the CMH full board meeting minutes from Wednesday, April 22nd, 2026.
Support.
Motion from Sharita, support from Jackie. Perfect. Comments, questions on the minutes? Seeing and hearing none, all in favor say aye.
Aye.
Aye. All opposed? Minutes are adopted. Move on to item 6, a request to approve the CMH board program and budget meeting minutes from Wednesday, May 13th, 2026. I'll take a motion to approve.
So moved. Support.
Motion from Megan, support from Sharita. Comments, questions on the minutes? Hearing and seeing none, all in favor say aye. Aye. All opposed? Minutes are adopted. Now we'll move on to item 7. We have a couple new items and a couple items for program and budget. We'll start with new items, and I will turn item A, request to approve recommended candidates for CMH board officers, over to Lori.
Okay, an email was sent. Accepted, and then myself, Lori Phillips, Secretary Treasurer, was nominated, and I did accept. So this is open to, are there any other nominations at this time? Other nominations? Okay, we'll close the nominations and we'll vote in for our new executive board.
Nick, you want to make that motion?
Move to elect the chair, vice chair, and secretary treasurer as recommended by the nominating commission.
Motion from Nick, support from Megan. Comments, questions?
Yeah, congratulations.
Can we vote? Let's vote first. All in favor say aye.
Aye.
All opposed? Now we're good.
You had to take that vote before somebody changed their mind.
Yeah. Thank you, everybody. I'm looking forward to another year of navigating this mess to the best of our abilities, and I appreciate all of you for being here and serving with me. Makes this job a lot easier. Now we will move. Lori, you good? Want to say something? Okay. Now we'll move on to B. We have the request to approve the 26-27 committee list. That is all in front of you. I had to make one minor change. I had Lori accidentally on the Citizens Advisory Committee as the delegate, and it should be Jackie, which is on the paper in front of you. It just wasn't in the copy that was emailed around. So I apologize for that mistake. That was my oversight. Sorry, Jackie. But other than that, I will take a motion to approve the committee list. Motion
Support.
from Jackie, support from Nick. Are there any comments or questions on the list? Okay, and I appreciate some of our new members stepping up. We're trying to shuffle things around a little bit to get everybody a little more involved in everything that we're doing. So I appreciate you stepping up and doing that. Seeing no other speakers, all in favor say aye.
Aye.
Aye. All opposed? Committee list is adopted. Now move on to item 7C. I'll take a motion to approve MLS Group of Companies LLC Services Agreement. This has been approved by legal.
Support.
Motion from Sharita, support from Julia. Tracy.
This is agreement to further expand our second level reviews for OT, PT, and speech. Just to be clear though, even with this expansion, if we do get somebody who has expertise in OT, PT, or speech, that does not supersede the second party review by a DO or a MD, right? So what'll happen is we'll have this group look over it, but then the reality is if the doctor disagrees, the doctor supersedes for some reason. But if they do disagree, then we would want some type of consultation to figure out why there is a gap. So we have not, until you guys approve this, we have not implemented it, so we will have to work out some logistics. But we thought it was a good quality review to ensure that the people who are, should be getting the services for OT, PT, and speech are getting the right services at the right levels for the right duration.
Thank you, Tracy. Any questions? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next is going to be item D, request to approve out-of-state travel transportation change for the Clubhouse Conference. I'll take a motion to approve. Motion from Jackie, I think support from Julia.
Awesome.
You're up.
Thank you. This is my first time, so I don't know what to say or how to say it, but I'm going to try it really hard. My name is Jen. I'm the program director at Crossroads Clubhouse. So we had a change in the mode of transportation. So we switched from car to airplane because the staff that's going had some obligations that just kind of popped up. She's got a kid graduating from high school, and we have a member who's going with us whose mom doesn't drive at night. It was just something that just kind of came up. So we asked that we could, if that's okay, we'd like to do it. So I don't know. Does
So
anybody
they're
have any
coming back to you
questions?
because there's a difference in price. Originally, they put, there would be no cost for transportation because they were going to use
Yes.
an MCCMH
Yes,
issued
vehicle. Yes, I'm sorry. Yep.
No, no,
and
just
then
adding further context. You're doing a great job.
I'm sweating bullets and I'm shaking.
You're
I'm
doing
feeling
a
my
great
throat.
job.
It's fine. I talk to people all day long, and like all of a sudden I'm like, what's happening?
It's hard standing in that spot. Even as somebody that sits back here, when I get up there, I get nervous too. It's totally the same. But yeah, thank you, Jen, for coming before us, and I appreciate you getting the information to us timely so we could do it today. I know there was, there's a lot of logistics that go with it, so I appreciate you getting that to us.
Of course.
Are there any board members that have any questions?
Thank you. Thank you. And I'm doing the best I can to take as many notes. I'm sure Sandy's like, listen, if she talks about taking notes, I might be upset. But every time I do something, I just make a note, and I have a binder at my desk, so I'm learning. It's awesome. I implore you guys to come and visit us. Please come visit us. Come have lunch. Come hang out with us. Join us up in one of our volunteer opportunities. We'd love to have you. Really.
Thank you, Jen.
You're welcome.
All right, seeing no other questions, we have a motion and support. All in favor, say aye. Aye. All opposed? Motion passes.
Yay! Thank
Enjoy
you.
your trip.
Thank you so much, you guys.
Thank you, Jen. Next is going to be items 7E and F. Those were both discussed at program and budget, so I will take a motion to approve both of those items together.
So moved. Support.
Motion from Megan, support from Lori. Are there any other questions, comments, discussion on these items? Hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Now we will move on to item 8, and I will take a motion to approve paying the bills. Motion from Julia, support from Sharita. Comments, questions on the bills we pay? Seeing and hearing none. All in favor say aye.
Aye.
Aye. All opposed? Motion passes. It's great that we paid the bills because Ken's here. CFO update. Go ahead, Ken.
It's in a nice order. I figure if there's questions about the bills, those would be for me anyway. So, good evening, everybody. I'll do my usual. I'm starting on page 1 of the March packet. I think there might have been, Sandy, was the February packet distributed?
February and March.
Okay, I'll go through March. February is there for your information. I think March is more current. If there's questions about February, I'm happy to take them, but I'm gonna go through the March packet right now. If we look at our revenue and eligibles charts on the first page, we continue to see a decrease in both revenue and eligibles. This has been communicated statewide multiple times to MDHH's actuary team. So we're hoping for a mid-year rate adjustment that reflects the decrease in eligibles at a minimum, and potentially some of our increased costs as well. So we keep an eye on this, but have limited control over, obviously, the people we serve, get them into Medicaid immediately, but the broader population have limited control over that effort. The next page, I'm just going to highlight it in the liabilities box. You know, this kind of summarizes our balance sheet. We have quite a large due to state unearned and lease liability. That's strictly due to our lapses to the state and unearned revenue. The unearned revenue is our savings, which is how we have to record that on our books. But I just wanted to point that out because that's quite a disparity compared to the end of last year, but it is as expected. Going to the next page, just highlighting here that the revenues are down for capitation, as I just went through. And the next box, you can see expenses are up. So that kind of speaks to some of the things I'm going to cover next. Page 4, this is our revenues and expenses by fund source. Really the best, in my opinion, information that we have about our finances. You can see the first 2 boxes there, Medicaid and Healthy Michigan. That's roughly you add those together, it's about a $7.5 million loss through March. Annualized, we're in that 14 to 15 million range. I think we budgeted for 14 coming out of the ISF, so we're trending a little higher on that. Down in the next 2 boxes, you can see our CCBHC and for both Healthy Michigan and Medicaid. Again, as usual, we would kind of add those together to think about that program as a whole. We are running a surplus there, which is good. As a reminder, this is based on potential T1040s, not paid T1040s. T1040s being the representing an eligible day under the CCBHC program, so a PPS 1 day. So this is assuming that we're going to collect most, if not all, of those payments that we now have to bill directly to the state. At the bottom of this page, you can see our risk reserve and our savings. The way this calculation works, you can see in our savings, we're actually looking at taking a roughly $5 million loss out of our savings. The reason for the savings amount going down in 26 is because it is tied to revenue. So when the CCBHC amounts were pulled out, our possible savings balance went down. So we should be able to take $5 million out of savings, so it offsets some of our ISF problems slightly. So you can see there we're pulled just under 10 million out of the ISF in fiscal 26. So we continue to advocate, statewide about revenue in particular, what we can do there, and hopefully we have good news from the state in the future. Going to the next page, CCBHC non-Medicaid. I don't think there's anything terribly unusual here. We're trending to spend about $4 million out of CCBHC non-Medicaid. Might actually be a little light when we get to the end of the year. I think last year we were at 4.7. So there's nothing terribly out of line there. Next box is state general fund. If you just look at the revenue and expense lines, we're actually spending less than revenue, which is good. but we pull quite a bit of it out to fund CCBHC non-Medicaid, which is that redirect line that you see there. At the end of the day, the bottom line there on that page, that $3.2 million, expect to be able to put that into local fund balance. So we've got kind of this, when you look at all the funding source buckets individually, Medicaid's obviously down, so we're pulling out of a specific reserve for that. But we're able to add to our local revenues, which are, I guess I'll call them the best revenues, the least restrictive revenues that we have. So that's good news from that perspective. But the Medicaid is where we are really focusing our efforts this year. I usually stop here. I'll take questions. There's a number of pages in the back. I am curious, as we look at this reporting package, I've been doing the same thing for a number of years now. I'm curious if there's things in here that you feel are missing or you'd like to see, and or things that we can subtract. I mean, we spend time doing some of this. The top 10 providers being an example. I don't know if that has value to the board. But I'd love to hear feedback on that, even if it's not tonight, via email, through Sandy or those means, just to make sure that this is valuable. I do think those funding source pages are the best information, but our balance sheet and income statement that are the following pages are somewhat condensed and don't really tell a picture of what's going on. They're more on the GAAP accounting basis. So anyway, I wanted to throw that out there if anyone felt to have any commentary or changes to that. Any questions before I get into my narrative type items or things that are hot topics? All right. I think the biggest one, we've touched on it a little bit. It's starting, the closer we get, the more concerning it gets, and that's HR 1. If not familiar with that, it's the changes to Medicaid based on the big beautiful bill. I'm calling it HR 1 now. For simplicity's sake, we've kind of talked about the two big changes there. One being the work requirements and the documentation of that. I believe it's 80 hours a month of a mix of work or volunteer time and maybe one other category. But biannual recertification is going to be cumbersome, not only to people, but the state and everybody else, including ourselves, that interact with this on a daily basis. The third one that's come up recently is in regards to immigration status. So the feds have issued guidance about who qualifies under that. So anybody that doesn't fit those, I think there's 3 categories, Tracy, in that. So some people are going to roll off of Medicaid as a result of that, and then they end up in what they call the ESO, which is emergency services only bucket. So be inpatient and that type of things, just to keep someone out of harm effectively, but nothing other than that. So we're monitoring that very closely. I believe in June the CMS is supposed to issue some guidance around the upcoming changes. The state will then have to digest, interpret, and give us some information on that. So January 1 of 27 is kind of when it starts, and it starts to get, in my opinion, progressively worse as you go month by month and they start recertifying folks and that kind of thing. So that is one that is concerning not only to our finances, but to people and services in general. It's going to make it very hard to budget for this year. So once again, those that have been here for a while have heard me say the budget is our best guess, and it truly is. And this year it might even be more of a guess, which is hard to believe because I thought last year would be the biggest guess we had. So I covered mid-year rates a little bit. It's not clear from the state I think they're working on it. In the discussions I've been a part of or the things I've heard for 26 rates and what we can do there. 2027 rates, I think they were targeting a May meeting to talk about 27 rates. We're obviously short on May time, and I haven't seen anything related to that. So I'll certainly keep the group updated on that. We tend to get fiscal 27 rates in this case very late in the game. Again, it makes it very hard to budget. But we do our best and hopefully have at least a modest increase to our rates. Wanted to, highlight a good thing. I'll say a good thing for our provider network. We went through, based on the DCW minimum wage information that we had in the January 1 of 26 bump. We looked at a number of our rates that would be applicable, and we found that our specialized residential network, the models we had needed an adjustment on that. So we did push a little over 3% out to our residential providers that are, we say at the base, they're not specialized programs and things that are already likely funding, paying folks higher than the minimum wage. So we did tailor it to providers. So we pushed that out this week. Those numbers are not reflective in the ISF. So that was about $600,000 that we had there that would be added to that. Next thing I have is audit status. We have our compliance exam due on June 30. As it was in the past, our compliance auditors would not issue that report until they're able to agree it to the audited financials as we're part of the county. So I did hear from the county CFO today. They're looking at June 30, feel that they're on target for that. So hopefully we can get that report issued on time this year along with our other filings. So does seem to be going better. We're getting wrap-up questions from the auditors on the financial statement side. We're working with our compliance auditors to wrap those items up. But at this time, I'm not aware of anything specific coming out of those audits, but we'll keep the group updated to that. The final thing I had was our CCBHC. Seems to be a weekly occurrence with reporting and requests from the state on those. We are trying to capture anticipated costs is what they call it. So the direct pay change and what the impact that it's had here, particularly we've had more hours for the billing team. There's costs there. Our quality team is spending more time than they had to in the past working this because of these problems. IT, we've had just gobs of system change as a result of this. So I think it was just under $1 million in costs that we had on there that were strictly related to the direct pay change and the administrative burden of doing so. So we submitted that. I hope that turns out to be good news. I think we're on round 2 or 3 of comments, but want the group to be aware of that we might see a boost in our CCBHC revenue if we can capture those costs. So that's all I have. If that's not enough. But.
Remember when I said mess earlier? Like, that's not really us per se, it's what's happening to us.
Yeah. We're just writing mess at the top next month. I don't know.
Anybody have any questions for Ken? Okay, thank you, Ken.
Thanks,
And as Ken said, if you have any suggestions for changes for his reports, shoot it to Ken, Tracy, and myself, and we'll go from there. And with that, we'll move it over to Tracy with the CEO update.
I will state it slightly differently than what Phil just said, which is we're doing extra work that we don't actually think we need to unless you desire it. So by you saying, I don't pay attention to this, or this is not that helpful to me, it will actually create less administrative burden for the staff doing it. So again, if there's something that's not helpful, doesn't mean you can't request that same information at any time. Does that make sense? But it really is helpful if you go through the pages and you're like, no, right? Because we only want to give you what, or if something's missing, right? Some other information that might be helpful. The great news is Ken and I are on the same page because my item is also in your board report that was sent last night, and also in your board education is the H1 stuff. So the good news is Ken had said some items that are going to cover it. I'll just add some additional information. So we didn't even get together and we're like this. So, again, in their board report that you received last night, I'm gonna draw your attention to a couple things. If you didn't see it, in the M Live, we had a SUD article. Gave you the link, definitely read it if you already haven't. Although Dana is not here, if you haven't checked out, there is a Macomb Daily article where she is featured. So again, you can refer to my report if you wanna check out the link, and definitely, reshare on social. Megan is also featured for Mark Quest's Who's Who. So Megan, for all the great work that she's done in her industry and for her organization. So again, if you haven't seen it, please check it out and also reshare on social. We're very proud of you. I know that's the fun subject. We're going to switch back into the
Hard left.
yes. So the link is in your report, but you should have this in front of you. I am not going to review the entire thing because this is about an hours-long presentation. And again, fortunately, Ken did mention some of the major points. I'm just going to highlight some additional items to reinforce what was shared, but also just to kind of summarize it. But please go through this because this will be a large impact on the community that we serve moving forward. So the very large highlights is as Ken pointed out, you'll hear it called H1, AKA the Big Beautiful Bill, AKA also known as the Budget Reconciliation Act of 2025. So if you hear any of those are all one and the same. It is January 2027 with CMS putting out documentation and guidance in June of 26. So anything that we're saying is just kind of the rough ideas, and based on the guidance, it might or might not affect what we're sharing. One of the major things is MDHHS, or the state of Michigan, did have the ability to do a few things. Like they had some ability to elect some processes. One example is they chose to do employment verification for 1 month, and it's the previous month of when they applied. So that was how they elected to do it instead of going back 3 months. The major dates to keep in mind is October 1st of 2026. That is actually when the new applicant for non-citizenship begins. So if I'm already an applicant, we're talking about somebody who's new, October 1st of 2026. If you're not a citizen, a eligible resident, or there is a special population for Haitian, Cuban, and I believe, forgive me, I'm forgetting the third area, and it has very specific status. Macomb County Community Mental Health does not determine eligibility for Medicaid at all, nor does it plan on doing that. It does assist individuals in applying for it. So it is in our best interest to understand it, so if somebody comes to our door and needs help, we can help them and educate them on their choices. As Ken stated, if they're not eligible for Medicaid and they were in the past, they would still be eligible unless they're an illegal alien for the emergency services. Now that I just said that is true for all. I just misspoke. So all can access the emergency services, which is basically hospitalization. That is not any services that we do pay for inpatient hospitalization, but there's no other crisis services that they could potentially access to the best of our knowledge. For example, you guys know we do under the CCBHC, we do mobile crisis. Well, we don't check eligibility for mobile crisis, right? So, but let's just say it does get determined that the CCBHC has to follow this rule, then we would have to figure out something, because then in theory, we couldn't provide services to anyone without asking. So that is an example of unknowns. We're currently creating a list of all our questions, right? So as guidance comes out, to try to better guide the community on what they can or cannot get. And then March 1st, 2027 is when the work requirements and the 6-month look back period begins for current people on Medicaid. So you have new applicants, and then you have, if you're already in the system, you have 2 different dates that you have to keep in mind. And everything that I'm saying, please don't feel like you need to remember it. For example, the timelines, you have a little chart of the timelines. Again, just to save us some time, if you could glance through this, and if you have any questions, please reach out. We do want you to have a high-level understanding of what is occurring. Moving on back to the more positive, thank you, multiple people, for attending the awards. We're very excited. If you haven't seen them yet, we're sharing pictures on social. If you have pictures or things that you want to share, please share them so we can put them out there and continue over the next year to celebrate. As you all know, we don't want this to be a one-time event. We want this to be a continuous celebration of the good that the community does. And then just drawing your attention, this is also on your board report, there does continue to be directly related to the lack of revenue to pay for the minimum wage increase that has already occurred and then will also reoccur in January 1st of 2027. So I'm sure you will hear in the community people advocating for that. Also, the state association has like a call to action. If you're not familiar with their call to action, you can go to their website. They'll describe what's happening, and there is an ability for you to kind of sign on and send a letter very conveniently by typing in where you live or where you work to the local state representative or the senator of the state for that area of topic. So if you have not done that, please, and I can reshare the link with you, but please read through that so you have an understanding, and I would encourage you to use that call of action not only for your general knowledge, but also to promote funding to increase directly to cover the gap that exists now, plus the gap that will continue to expand on January 1st of 2027.
And I can tell you they're working because our office has been receiving them. So
Good.
they are going out last week or so. Thank you, Tracy. Any comments or questions for Tracy? Megan,
Tracy only or just for everybody?
shoot your
Say
shot.
it like that.
Oh my gosh. And I feel like everybody who was there will say the same exact thing. That was amazing. The Mental Health Matters Awards, we are so blessed. I seriously, honest to God, was so inspired. We were all sobbing together by everybody who talked. It was just so, all of them have been amazing, but this one was just fabulous. You and your team, every single one, from the tip of the top to every single person who contributed, who volunteered, who smiled and was a perfect, happy smile when people came in. It was just like beaming with pride to even know any of you. It was just so fabulous. It was the best one yet. Amazing. You and your team are fabulous. I had to. Sorry.
That's okay. Well said, Megan. Spot on. She's absolutely right. It was a great event. They seem to get better and better every year. I mean, just the highlighting of the folks in our community that work and serve and just it's a great evening. It's a great event. Drew got a special shout out. Best dressed at the wedding. But yeah, like Megan said, thank you to Tracy and the entire staff, because everybody who could be there was there. All hands on deck event, and it looked like it because everything went smooth.
I will pass it along. That is a ton of work to get there. So, but it's worth it.
Yes, absolutely.
If you know where you're going, I don't know what to tell you.
All right. With that, we'll move on to some reminders. We do not have program and budget for June because some of you will be returning from Traverse City. Jealous. And full board will be Wednesday, June 24th here at 6 o'clock. Are there any? Nick?
You skipped other agenda items, and I had one.
Have at it. I'm sorry.
That's all right. We'll just go back.
I'm on a roll tonight.
That's good. I just wanted to say now that the committees have been reconstituted, there's no grass growing under our feet. Those of you who sit on the Policy and Legislative Committee expect to be polled on a date. We would like to meet relatively quickly. The issue has been the framework, and Tracy's written about this and talked about it, so some of you are familiar with it. There has now been introduced in the House a bill to implement that framework. That's bad because the framework is crazy, but secondly, it's also problematic because it is a multi-section mental health code bill, which means it could be amended to do anything to change things in the mental health code. So we're going to have to watch it carefully. And we have to go over it because we haven't, as I said, taken a position yet as the board and report back to the full board. Just as a point of interest, so everybody knows, Phil and Tracy and I are sending a letter to the Macomb delegation on the boilerplate that was included in the House. I think you've written about this as well, Tracy. The state association was successful in getting boilerplate language into the House omnibus appropriation bill that would prohibit the department, essentially prohibit the department from going forward with another RFP like the one that was struck down by the courts. The Senate did not include that, so now that's a matter of difference, and it'll be discussed by the leadership probably by the leadership as they work through the adoption of next year's budget. So there's like good news and bad news. That's going to be a tough sell, I think, but because we got to get the governor and the Senate on board. But we're going to work on it. The House is already on board. That's very good. The framework issue is scary because we don't know what they're going to do. But the good news is that the department has indicated that they're putting it on hold for at least a year because nobody's ready to do that if you wanted to anyways. And I think the biggest problem, there's lots of problems with that, but probably the biggest problem is the fact that people could end up being bounced from one payer to another with different provider networks and create all sorts of confusion. But at any rate, we're going to be working on both of those things. So expect to be polled on a date and time for a meeting within the next week or so. And we'll copy the letter that we get out to everybody as well once that goes out on the boilerplate language.
Thank you, Nick. You may add.
So, Nick mentioned the budget language. It does also have there in WASCL to reimburse the cost that's already expended. Also directly related to WASCL, it has that in there because the concern is when you have Washtenaw, which was one of the original plaintiffs, when they're starting to do some of these budgets, the budgets are increasing by 100-fold. And they're asking for, the examples they gave was one wanted a $30,000 bonus to the staff, another one wanted to pay $45 because the way it's written, per hour for the staff. Because the way it's written, it allows that and it doesn't have any safeguards, or I shouldn't say that, it doesn't have solid safeguards where what happens is unfortunately it ends up pinning the person and their family against the organization trying to fund that, and that's never good because they're both supposed to be working towards the same end goal. So we're excited they at least have, it needs to be clarified, more guidance needs to come out. Right now it's very open-ended and causing concerns. So the budget language has WASCL, the mental health framework, and the RFP language that Nick was mentioning.
Thank you, Tracy. Anybody else with anything to add? Okay. Now we'll move on to provider comments. Any providers in the audience wish to address the board? Come on up, Sue.
So I just want to, I'm Susan Stipe from CARE, Southeastern Michigan. On Friday, June 26th, we're doing our second annual Michigan Recovery Con and Film Festival. What is notable this year, especially being an election year, we are having our youth from our coalitions come and talk about issues that are important to them. We have invited most of the Macomb delegation because it's something that we're bringing in elected officials. I thought it was important to inform you guys if you're interested. It will be at the MISD, and the youth panel will happen toward the end of the day. The time is from 11 to 7 o'clock, and then our keynote speaker will finish out our day. So if you're available, we'd love to see you come by. It's just come on in. There's no charge for the event at all, and we're looking forward to it. Thank you.
Thank you. Shrita, Sue, before you run off, Shrita's got a question for you.
Oh, sorry, she did. I couldn't catch the date, but she said 6/26, right?
That's correct, Friday, yes.
Thank you. Teamwork, love it. I don't see any other providers in the audience, so we'll move on to hearing of the public. Anybody from the public? Come on up to the microphone. You got 5 minutes. Give us your name and Absolutely.
Okay, I'm Kelsey. I'm Kelsey Taylor. This is my mom, Ellen Taylor. I was. How do I say this, Mom?
Just the way that it happened, kiddo.
I was assaulted
By whom?
by my roommate. And I did nothing to her. She had I guess there was a physical altercation downstairs. And she came upstairs and took it out on me. And they didn't punish her. I was at my mom's for what, 2 weeks?
3.
3. I was at my mom's for 3 weeks because I was afraid to go back there because she sucker punched me in the face.
Suggestions about what our course of action should be.
Yes.
We've done recipient rights, and Kelsey has chosen to go back because she wanted to continue to participate in the other things that are contingent on that placement that we would then have to rearrange to come back to our home. I understand that this is how it works, but both of us are here to tell you that it stinks.
And my face did not enjoy that.
No.
My face was actually numb after she did that.
For a while.
Yeah. I just got feeling back in my face the other day.
I realize this is a personal issue, but it's something that you need to be aware of, that your constituents are dealing with. And we'd like some suggestions or direction or something, because it's not good when you've done nothing wrong, you're laying in your bed, you come in and somebody punches you in the face.
And keep in mind, I was on the phone.
It doesn't matter, kiddo. In her own home, assaulted by her roommate, and her roommate was not examined by the hospital. She was taken, but they discharged her and sent her home less than 8 hours later. And Kelsey missed 3 weeks worth of program because she was afraid to go there. And I wasn't comfortable sending her back until her roommate had been examined by the mental health providers, to make sure that there wasn't something that needed to be adjusted. I know that's HIPAA protected information, but
We need to know that she's safe.
I need to know, 1, that Kelsey's safe, and 2, that Heather's issues are addressed, both for Kelsey's safety, but for also the safety of the other people who live and work in that home. Because it was
It was me and Trey Agenay that were assaulted.
well, that and Cindy too.
That too.
So it was 2 staff and
2
Kelsey.
staff and me.
So we can't respond during public comment, but we do have staff that will reach out to you afterwards.
That's wonderful.
And we appreciate
Thank you
you.
for letting us speak.
Thank you for coming today. And thank you for sharing your story with us. Anyone else from the public wishing to speak? Okay, hearing and seeing none, we will close hearing of the public, and we will move into closed session. And I will take a motion to discuss attorney-client privilege memo dated May 27th, 2026, pursuant to MCL 15.2681H. Motion from Megan, support from Jackie, and I will do a roll call vote. Jackie? Yes. Lori? Megan? Yes. Myself, yes. Shrita? Yes. Julia? Nick? And Steph. All right, we will enter closed session. I think we'll keep Ken and Drew and everybody else. We'll clear the room.
I know.
All right, we are back, and I will take a motion to adjourn.
So moved. Support.
Motion from Megan, support from Jackie. All in favor? Aye. All opposed? We are adjourned.